Hello, my dear nursing aspirants. Welcome you all to the Master Nursing classes. ನಿಮಗೆಲ್ಲರಿಗೂ ಮಾಸ್ಟರ್ ನರ್ಸಿಂಗ್ ಕ್ಲಾಸಸ್ಗೆ ಸ್ವಾಗತ. In this today's class, I am going to discuss a very examiner's hot topic that is related to the ECG. So this class, it will start from very basic to very advanced. Why? Because without knowing the basic thing, you people can't study the advanced thing in the ECG. And even if you are mugging of the ECG things, that will won't remember and that will not going to help in the exams. So no related to the basic how the waves will come. Okay, what is the P wave? What is the Q wave? R wave, S wave, and T wave? Okay, and before that you have to know about the conduction system of the heart, how the electrical impulses are generating, where it is generating, how it is passing. Okay, so each and everything, and the most important thing that is important for you all to know before going to the main exams, that is especially NORCET exam and RRB exams and your KE exams. So this is such a kind of the hard topic where the examiner is very interested. Not only interested, he is very interested to ask the questions from the practical things of the ECG. So that is from the lead placement, where you have to place the V1 chest lead, where you have to place the V2 chest lead. Okay, so related to the limb leads, they can ask the exam because it is most important as scenario of the practical and as scenario of the theory also. So here I will take you people from very basic and from practical and from theory, and I will make you people to be excellence in the ECG, and very importantly the examiner's point of the views and the examiner's point questions I will describe here in each and every questions. So whatever the questions we are discussing here is not only a single question. In one particular question I will solve the all possible questions, that is very much helpful for you all in the upcoming exams, right? So without wasting the time, we will start the today's class, and there is one request to you all who are watching the class. So please hit the like button now. Yes, so rotate your mobile and hit the like button. And if anyone is watching the master nursing classes first time, so please do subscribe to the channel. Your likes and subscribes are a real boost for us, so it improves our energy to bring the more content towards you people, right? So who all are live to the session, yes, please join to the live chat. So this class should be a must and very interactive class, so that helps both of the students and faculties also to create the interest and to tell the more points to you people, right? Yes, without wasting the time, we will start the class. Fatafat do subscribe and like to the session. Fatafat do like to the session. We'll start now. Yes. So first of all, I will start with a very basic thing, and all of you know in your clinical setting, I think you people have seen this image. This is the ECG machine image. Okay, this is the ECG machine. So it may strike as image based questions for you all in your upcoming exams. Okay, IBQ means here's the image based question. So this is the ECG machine, and this paper which is coming here is the ECG strip. We can say this one is the ECG strip, right? And these all are the chest leads. These all are the chest leads, and these four are the limb leads, or we can say augmented leads. Very important. Okay, so these leads are also called as the augmented leads, and we are used to these leads to apply to the limbs, all four limbs. Okay, to upper limbs, to lower limbs, and four leads are there. Okay, so here the chest leads, total number of the chest leads, the examiner will ask the question. The total number of the chest leads are 6. Okay, how many chest leads are there? 6 chest leads. And total number of the limb leads are the 4, but we will consider it as a 3. We'll consider it as a 3. Why? Because this black color lead we will not consider, and this lead is the neutral one, and this is used to apply for the our right foot. So the lead which is applying for the right foot is a neutral lead. Okay, so this lead we will not count in the our ECG leads. Okay, so this particular black color lead we are applying to the right foot. So this is neutral in nature. So we will not consider this one in the count. Okay, so many times we heard there are 12 lead ECG, 12 lead ECG, 12 lead ECG, and here only 6 chest leads and 3 augmented leads. Sir, only total number of the counts become 9 here. Then where are the 3 more leads? So 3 more leads are the standard leads which are imaginary in nature, and I will teach those leads while teaching the William Anthony triangle to you people. Okay, so consider now it's 9 leads plus 3 standard leads. Okay, 3 standard leads. Very, very importantly. So total number of the leads are the 12 lead ECG. Okay, 12 lead ECG. 3 standard leads, 6 just leads, plus 3 augmented leads. 3 plus 3, 6. 6 plus 6, 12. So total number of the ECG leads are the 12 lead. Okay, this may ask in your exams. Okay, hope it is a very basic and clear to you all related to the equipments of the ECG, and try to give the first question and very basic question for your exams. This may strikes directly in your RRB exams. Okay. Question is like this: which of the following is used to measure the electrical activity of the heart? I'm waiting for your answer. It's very basic question. I hope all of you will give the a correct answer for this one. Yes, option A DEXA scan, option B electroencephalogram, option C electrocardiogram, and option D electromyogram. Yes, I'm waiting for your answer. Very nice of you all. Okay, so it's an ECG, that is the electrocardiogram. So electrocardiogram means this process where we are assessing the electrical activity of the heart. Okay, so electrical activity of the heart we are checking means that is the electrocardiogram. If in case electrical activity of the brain we are checking means we are checking the electrical activity of the brain. So that is what we call as the electro means electric activity. Encephalo means brain. Gram means it's just a process or the procedure. Okay. So the electroencephalogram means we are checking the electrical activity of the brain here. Okay. So this is the investigation of choice in seizure. So what is the investigation of choice in the seizure? That is the EEG. The electroencephalogram is the investigation of choice in the seizure. Very, very important. So then I will come for the option D, that is EMG. Okay. So EMG is the electromyography or electromyogram. Okay. So in this one, we are checking the electrical activity from the muscle fibers. Electrical conducting activity of the muscle fibers we are checking means that is the myogram. Okay, so that is the electromyography or electromyogram, right? So very, very important for you all, and the correct answer for this question is the option C, electrocardiogram. ECG is the where we are checking the electrical activity of the heart. So then comes to the DEXA scan. So what it means, the DEXA scan, and this DEXA scan is a 10-star questions the examiner will throw in this upcoming NARCET bacho. So read it once. Please read it once. So what is it? So that is the what is the meaning of the DEXA scan? The D stands here, the dual. Dual. E stands here as the energy. X stands here as the X-ray. A stands here as the absorbometry. So what is the full form of the DEXA scan? It's a dual energy X-ray absorbometry is the full form of the DEXA scan. Right? Sir, what is the another name of this DEXA scan, sir? It's a simply called as the bone scan. It's a simply called as the bone scan, where we are using the dual means double power of the X-ray to scan all parts of the bone from the head to toe. Okay, so from the head to toe, we have to scan the all part of the bones. That is called as the dual energy X-ray absorbometry. So this one is the best investigation in the case of the osteoporosis. बच्चों, the question will not limits here because you people wants to become a nursing officer in AIMS. So where you want to take a lakh rupees salary per month means you have to know something more about this one. So I will describe the interpretation of the DEXA scan. So please make note of this in your last minute revision notebook and give best shot in the exam in the name of the master nursing classes. Your rank will be float in the top 10 students. Okay. So that is the DEXA scan interpretation where we are having the two type of the scoring system here. So one is the T score and one is Z score. Okay, one is T score and one is the Z score. Among these two, the T score is most important and all people have to know about this one only. Okay, so the T score is generated by comparing the patient's bone density to a to a young person bone density. Okay, consider if the patient is of the 60-year-old, where we have to compare this patient bone density to a young patient, means to a 25-year to 30-year patient's bone density, and this particular patient bone density we have to check here. So compare here and we have to give the scoring system. All you people have to remember is in the T score the comparison between the young bone and the patient bone. That's it. Okay. So but in the Z score, just a second, I will change the pen size here. Okay. So in the Z score, it's very important. The patient bone density is compared with same age group. Okay, very important. If the patient is 60-year-old, his bone density will be compared with the 60-year-old patient only. Okay, so that is the Z score. And the interpretation all people have to remember for the DEXA scan is the very important. From the T score only people have to remember this one. Okay, in the T score, the interpretation value which is coming -1 and more means the normal bone density. It indicating the normal bone density, right? If in case the value is between the -1 to -2.5, it indicating the osteopenia. What it indicates? It indicates the osteopenia. Okay. If in case it is more than, sorry, if in case it is less than -2.5, okay, so it indicates the osteoporosis. This question, which is asked in the recent exams, okay, many times, remember the T score value from the DEXA scan, which indicates the osteoporosis, is option A -1, option B -2, option C 3 -2.5, option D less than -2.5. So your answer would be the less than -2.5 is the very important thing which indicates the osteoporosis, right? Which indicates the osteoporosis. Important, bacho, I am telling it is very important. Make a note of this one. Okay, so it is done in the as an investigation of choice in the osteoporosis. There is a DEXA scan, and we have seen the T score here. Z score is not that much important for the interpretation of this one because the clinically most importantly which is used one is the T score only. Remember this much only. Okay, so very important. I hope the answer is clear for this question, and correct answer for this question is the option C. That is electrical activity of the heart is the ECG. Okay, and here's the next important question that all people have to know about the ECG. That is the who is known as the father of ECG. Yes, who is known as the father of ECG? Option D is Edward Jenner. Option C is Robert Koch. Option B is Paul Ehrlich. And option A is William Anthony. Yes, all of you people are giving the correct answer. A. That is the William Anthony. William Anthony is called as the father of ECG. Okay, so let me discuss the other questions related to this one. So, who is the father of the chemotherapy? Who is the father of the chemotherapy among these all three option here? Yes, yes, that is over already, bachon. The father of ECG is the William Entman. That is the correct answer, and all people have given the correct answer. Then give me the next question answer. That is the who is the father of the chemotherapy? Yes, comment first. Who is the father of the chemotherapy? Yes, very nice of you all. That is the Paul Ehrlich is the father of the chemotherapy. Is the father of the chemotherapy. Okay, important one. Then who is the father of the bacteriology? That is the Robert Koch is the father of the bacteriology. Very, very important. Then who discovered the vaccine? That is the smallpox vaccine. And who discovered the first vaccine? First vaccine discovered by the Edward Jenner. Okay. So Jenner na namu Janaka of the vaccine antanu karitivi ನೆನ್ಪಿಟ್ಕೊಳ್ಳಿ. Who is the father of the vaccine? Yes, who discovered the first vaccine? The same question, and the answer would be the Jenner. Jenner is the Janaka of the vaccine, right? ತಿಳಿತಾ ಎಲ್ಲರಿಗೂ? So it's important. ಬಹಳ important ಇದೆ. Okay. So first vaccine. Which is that first vaccine? The vaccine against the smallpox. Very, very important. Okay. So it's very important. Important questions. It will strike in your RRB exams. Why not in nursing? Narset means Narset never asked the father and mothers of questions like nowhere. Okay. But it is chances there. Okay. But it is our responsibility to revise the important thing and go for the exam. Whether it will comes or not comes in the exam, that is the secondary thing. Whether we are studying the important thing or not, that is going to be matter. If you are studying and revising the important thing, that will definitely strikes in the exam. 99.9% is chances there. Okay. So I hope the concept is clear on this one, right? So here is the next question for you people. Okay. So what is the primary purpose of using the conduction jelly during the ECG? Okay. I think all you people have seen this bottle in the ECG machine. Okay. So where we call this one as in the cardiac jelly. Cardiac jelly, or we can say the conduction jelly. We can say this one is in the conduction jelly also, right? So this conduction jelly is made up of the composition of the conduction jelly is the that is our sodium chloride. Okay, so this conduction jelly is made up of the sodium chloride. These questions may strikes in your exam. Okay, important, right? So what is the purpose of this particular conduction jelly or the cardiac jelly where we are using during the ECG? Option A, to sterilize the skin before the electrical placement. There is not necessary to sterilize the skin only, and it is not a purpose of the our conduction jelly here. I am eliminating the option A. So then option B, to protect the skin from irritation used by the electrodes. So electrodes is placed for only a short duration of the time, where for the 1 and 2 minutes. So there is no need of the using the extra things to reduce the irritation. Yes, there is irritation is there or not means yet it is there, but there is no need of the intervention because it is for a duration of the 1 minute or 2 minutes. When we will remove the leads from the chest, so there is no irritation. So option D I am eliminating. There is no need of the taking protection against the irritation while applying the electrodes. So it is not our answer, and the conduction jelly is not used for the reducing the irritation. Okay. So then option C, to reduce the heart rate. No, it is not a correct answer. And the yes, all of you have given the correct answer. That is the option B, to enhance. The what is the meaning of the enhance? Enhance means to increase. Okay. So or to improve. Okay, to enhance the electrical conductivity between the skin and electrodes. Bacho, so this is the chest of the patient, means where we are putting the electrodes like this. So the heart is like here in down. Okay, so the electrical activity should be captured from the heart, means in middle of this one the skin will come as a barrier. So to reduce the barrier and resistance from the skin, we are using the conduction jelly. This jelly directly captures the electrical activity and easily captures the electrical activity. So here the skin will not work as a barrier if we are using the conduction jelly. So this is the purpose of the using the conduction jelly or the cardiac jelly. Okay, so to enhance the electrical conductivity between the skin and the electrodes, okay, where the ECG machine can easily capture the signals here. Okay, so clear ಆಯ್ತು ಅನ್ಕೊಂತೀನಿ. And ಈ ಕ್ವಶನ್ ಎಕ್ಸಾಮ್ ಅಲ್ಲಿ ಬರ್ಬೋದು. So this questions may strikes an exam. The conduction jelly or the cardiac jelly is made up of the sodium chloride. Okay, so ಈ question ಗೆ ಆನ್ಸರ್ ಮಾಡಿ. Simple question here. So try to answer for this question. What is the conduction speed of the electrical impulses in the Purkinje fibers of the heart? Option A 0.05 second meter per second. Option B is the 1 meter per second. Option C is the 4 meter per second, and option D is the 6 meter per second. Conduction speed in the Purkinje fibers. I'm waiting for your answer in the comment box. Do fatafat. Yes. So few of you have given the correct answer. That is the 4 meter per second is the conduction speed in the Purkinje fibers, and this is the highest speed of the conduction. Highest speed of conduction. Okay, which happens in the Purkinje fibers only. Okay, so sir, what is the Purkinje fibers? Let me take a quick review on the conduction system of the heart. But this one what we call as on the SA node. Okay, so this one what we call as on the SA node. So this SA node is also known as the natural pacemaker of the heart. Okay, so the question many times asked in the exam, that is the natural pacemaker of the heart is the our SA node. This is having the ability of the conductivity, automaticity, and electricity impulse generating. What it means? Conductivity means it generates the impulses and it sends the impulses. Okay, it transmits the impulses. So transmission of the impulse is called as the conduction. Okay, so then automaticity means there is no need of the any continuous stimulation for this one. Okay, so I am continuously stimulating and it is producing the impulses, not like this. Even I am sleeping for 24 hours in a day, it will automatically work because the conduction system of the heart, it acts under the autonomic nervous system. Okay, so where if the sympathetic activity is there means the impulse generated will increases, and parasympathetic activity is there means the impulse generation will get decreases. Okay, so in the sympathetic generation activity, the heart rate become increases, and where the parasympathetic activity will be there, then that at that time the heart rate become decreases. Okay, this is how the SA node works. Okay, it is works under the autonomic nervous system very very importantly. And the second point, this is also called as the natural pacemaker of the heart. Okay, so the third most important point all people have to remember, the location of the SA node. It is present in the cavo-atrial junction. So what it means? Cavo-atrial junction means here from the superior side the vena cava is coming. So this is what we call as the vena cava, that is the cavo. Okay, and here it is the right atrium, right? So that is the atrium. Here the junction means the connection between the superior vena cava and atrium is there, this part. Okay, that is what we call as the cavo-atrial junction. So the SA node is located in the cavo-atrial junction, and if it is not there in the option, your answer would be the just below the superior vena cava. Okay, just below superior vena cava. If still it is not there in the option means upper part of the right atrium. Okay, so this is your answers. The first priority goes for the cavo-atrial junction. Okay, first part will go for the cavo-atrial junction, then just below the superior vena cava. Last one is the upper part of the or the superior part of the our right atrium would be the correct answer, that indicating the yes the location of the sinoatrial node or the SA node. Okay, so the next point is where it is generating the impulses. SA node, the rate of generation of impulses is 60 to 100 beats per minute. It is very very important. So because of the this conduction rate 60 to 100 beats per minute, so our normal heart rate is also between this one only, that is the 60 to 100 beats per minute. So the normal adult heart rate is the 60 to 100 beats per minute, and the single best answer is the 72 beats per minute is the Single best answer. And the range is the 60 to 100 beats per minute. If the heart rate is below 60, that is called as the bradycardia. If the heart rate more than 100, that is called as the tachycardia. Very, very importantly, all you people have to understand this one, right? So, next one is our AV node. Okay. So the SA node is finished. The next point is the AV node. So the SA node is responsible for transmitting the impulses to entire right atrium and to the entire left atrium also. Okay, this is also important related to the SA node. Okay, take a point of this one. Okay, the left atrium is supplied by, and the question kiya all you people will get confused. Okay, if the examiner asking the question, the left atrium is supplied by, yes, the left atrium is supplied by SA node or AV node, means you people will get confused here. So I'm clearing that. Yes, the left side atrium also completely supplied by the our SA node only. Okay, by the SA node only. Okay, so this is the fiber which is going from the SA node and which is supplying to the our very important left side atrium also. Okay, then come to the second one, that is the AV node. Okay, so in between the SA node and AV node, there is a connection. This is what we call as the internodal pathway. Okay, these internodal pathways only responsible for transmitting the signals from the SA node to the AV node. The question will come. So how that signals are transmitted from the SA node to the AV node means, yes, the signals are transmitted from the SA node to till the AV node by the intranodal pathway. Okay, so what we call this one as the internodal pathway. Okay, very important, right? Hope it's clear. So then few points on the AV nodes. AV node is also located in the right atrium, just above tricuspid wall. Look at the image here, bachcho. So this is the tricuspid wall. This one. Okay. So here we are having the three cusps, right? So this is what we call as the tricuspid wall, which is present between the right atrium and the right ventricle. In between the right atrium and right ventricle, which wall is there? So, sorry, that is the tricuspid wall. Right? So the AV node is just present above the tricuspid wall. It is very important. All you people have to know about this one, right? So the next point is the impulses next transmits from the our AV node to the bundle of His. Okay, so this particular point we have to call this one as the bundle of His. So let me make this one clear. Then I will teach you, right? So this particular, okay, let me highlight with other pen. Okay, this particular part, this is what you call as in the bundle of His. Okay, bundle of His. So it's very important, right? So from this bundle of His, the electrical signals will transmits to the bundle branch. Okay, so this bundle branch with this green color line, what you are seeing here, so this one is the right side, so we call this one as on the right bundle branch. In the next sessions, you people will study related to the right bundle branch block and the left bundle branch block and bundle of His block and formation of the delta wave. So here you people will get the clear concept where is the right bundle branch block, where will be the left bundle branch block. Okay, so if here you people will getting the block means that is called as the bundle of His block, and here to the right bundle branch you people are getting the block means we call this one as in the right side bundle branch block. Here this one is the left side bundle branch. Okay, so if in case you people are getting the questions like left side bundle branch block means it is blocking in the left side of the bundle of His. Okay, we can say this is the left bundle branch block. Okay, so all you people have to know here which is the right side bundle branch, which is the left side bundle branch. Okay, so this one is the right side, this one is the left side. Okay, these are called as the bundle branch, and the small fibers which are going here and supplying directly to the myocardium, So these small branches, we call this one as the Purkinje fibers. What we call this one as the, this one was called as the Purkinje fibers. Okay, so it's very important. And the electrical signals which are coming from the SA node till the Purkinje fibers, this is what we call as the conduction regulation of the heart. Okay, the examiner will throw a question in front of you. What is the sequence of the conduction of the heart? Okay, the signals are starting, or the impulse are starting from the SA node, that is the sinoatrial node. From there, it is coming to the AV node. Okay, from AV node to the bundle of His. Okay, from bundle of His to the bundle branch. From the bundle branch to the Purkinje fibers. Okay, so this is the sequence of the conduction system of the heart, and it is important, bacho. If in case the sinoatrial is get blocked, means that is called as the SA nodal block. If in case the bundle branch are blocked, means that is called as the bundle branch block. If it is right bundle branch block, that is the right side bundle branches get blocked here. Okay, so that one I will discuss in while studying the abnormal ECGs. Okay, this is what the basic will help you to make a very strong and knowledgeable person to crack any kind of the exams, right? So this is what all conduction related basics all people have to understand on this one. Okay, so try to solve the next question. I'm waiting for your answer here. Here our real ECG starts. Okay, so what does P wave represents in an ECG? Okay, this is the ECG graph. Look at the image. Okay, so here this one is the P wave, Q, R, S, and T. So the question is what the P wave represents here. Option A, ventricular depolarization. Option B, atrial depolarization. Option C, ventricular repolarization. Option D, atrial repolarization. What it indicates? Yes, and I will make a thing clear for you all, bachon. The word depolarization means the contraction, or we can say the systole. Okay, the word repolarization means the relaxation of the heart. The relaxation of the heart, or we can say the diastole of the heart. Important, right? So what is the meaning of the depolarization? Depolarization means contraction of the heart, and systole is the, yes, the contraction of the heart, and depolarization is the contraction of the heart. Everything is same here. Okay, so then repolarization means the relaxation of the heart or the diastole of the heart. Okay, yes, almost all people have the given correct answer. Yes, the P wave which formates during the atrial contraction. Okay, so the atrial contraction means your answer would be the atrial depolarization here. Okay, so atrial depolarization, this is the correct answer. So let me solve all the other related questions which is related to the formation of the ECG waves. Okay, so this is the normal ECG wave. Here the P wave. Here the P wave which is forming due to the atrial contraction, or we can say systole, right? And the QRS complex which is there here, this is forming due to the, yes, this is forming due to the, can anyone wants to comment in the answer? Comment the answer. Very nice of you all. Yes, yes, the QRS complex which is formed due to the contraction of the ventricle. So we can say this one as in the ventricle systole. Okay, important. Then the T wave which is there here, this one formed due to the, yes, ventricular diastole, or we can say repolarization. Very, very important question. Look at this one. Here also due to the systole or the diastole. Here also due to the systole or the diastole. only one wave which is forming due to the repolarization or due to the diastole. That one is the T wave. Okay, T wave is forming due to the relaxation. The T wave forms during the relaxation of the ventricles. Relaxation of the ventricles. Okay, so all you people have heard related to, I think, all you people have heard related to the defibrillator. Okay, so while giving the shock, whether you want what is the purpose of the giving shock in the defibrillator, okay, from the defibrillator, that is to make the heart to get contract. Okay, that is the purpose. Means where you have to give the shock on the P wave or the QRS complex or the T wave. Okay, so when you want to give the shock during the contraction only, we have to give the shock, because to make it more strong contraction, if in case by mistakenly if we are giving the shock on the T wave, means it makes the heart to get into the arrhythmias or the abnormal rhythms. Okay, so never ever give the defibrillator shock on the T wave. Okay, we have to give the defibrillator shock at the peak of the R wave or on the QRS complex. Okay, so the two questions will come here: when to deliver the defibrillator shock, to deliver the defibrillator shock on the peak of the R wave or on the QRS complex, right? So where we have not to deliver the defibrillator shock, yes, we should not, and we never ever should deliver the shock on the T wave. Okay, because it makes the heart to contract more abnormally. Okay, arrhythmia generates here, right? So it's very very important. Okay, bachcho, let me make the more points clear from this particular image, so that will help you people to solve many questions that is coming from the ECG. Okay, so yes, I have told how the ECG waves are forms: P waves by atrial systole or the atrial depolarization or the atrial contraction. Okay, so if any abnormality in the atria, like atrial flutter, atrial fibrillation, atrial tachycardia, or whatever it may be, any problem on the atrium, that is atrial enlargement, you want to see, means look at the P wave. Only P wave abnormality will be there. If you want any information related to the ventricular abnormality, like ventricular fibrillation, ventricular tachycardia, okay, and ventricular flutter, so these kind of the any ventricular problems you want to assess, means just go through the QRS complex and the abnormal will be manifest here. I am telling in general, okay, where to look at the ECG paper to check the assessment related to the abnormalities, right? So it's very very important. Okay, so two basic thing all people have to know about this one. Okay, so that is the important thing. So total number of the waves, how many total number of the waves are there in the ECG? The next question. Yes, the total number of the waves in the ECG are the 5. Okay, so let me count the waves for you all. Okay, option, sorry. The first wave is the P wave, which is the first wave in the ECG. That is the P wave. Okay, 1, Q, 2, 3, 4, and 5 waves. Total number of the waves are the 5 waves. How many total number of the negative waves? 2 negative waves. That is the Q and S. Okay, 2 negative waves. Negative waves 2 and 3 positive waves. 3 positive waves. Okay, it's important. Then comes to the how many isovolumetric lines are there in the ECG. Okay, how many isovolumetric lines are there in the ECG? So isovolumetric lines means these flat lines. Okay, so these flat lines. So these are called as the general lines. Don't consider these two. Okay, so only two lines are considered. This one and this one. So how many isovolumetric lines are there? So two isovolumetric lines are there. Okay, there is no any elevation, there is no any depression. Means it is connected to the baseline. So these lines are connected to the baselines. There is no elevation, there is no suppression. So that is called as the isovolumetric line. Okay, what we call this one as the isovolumetric line. Okay, very very important, right? So the total number of the waves 5, negative 2, positive 3. Isovolumetric line 2. Okay, important. So then the next one is how many segments are there and how many intervals are there. Yes, there are three intervals are there. First one is the PR interval. This one which starts from the starting of the P wave till to the starting of the our Q wave. बच्चों don't confuse P R means starts with the P and starts with R. No. Here look at the image and remember only this P and wave and P interval is having the problem. Other are normal. Okay. Yes, that is the other are simple only. So PR interval which starts with the P and which starts with the P then ends with the beginning of the Q. Okay, so it starts with the beginning of the P to the beginning of the Q. That is the PR interval. That is the PR interval. If in case it is starting with the begin at the end of the P wave, okay, and which is ending at the starting of the Q wave. Remember the PR interval which starts with the start of the P wave, but the PR segment it will start with the end of the P wave till to the Q wave. So that is what we call the PR segment. Okay. So the first one is the PR interval which starts with the P wave and end with the beginning of the Q wave. Okay. And next one is the QRS complex. So that is the second one. Okay. Second one is the QRS complex. So the QRS complex will form from the beginning of the Q wave, okay, till the end of the our S wave. Okay. So very important QRS complex which starts from the beginning of the Q wave and end with the end of the S wave. So that is what we call as the QRS complex. Very importantly. Second one. That this QRS complex is also called as the QRS interval also. This is also considered in the interval. Okay. It is a Q or S interval. Very important. Then next one is the ST segment, or we can say ST segment is not considered under the interval. So this one is the segment. We will consider that one later. Okay. So come to the again interval. So next one is the QT interval. QT interval which starts from the beginning of the Q wave till the T wave. So how to remember all these means just draw of QRS this one ECG graph 3 to 4 times in your notebook. Mention 2 to 3 times, so it will be very easy for you all. Okay, so like P Q R S T like this. Okay, so just separately people have to write this one. So from beginning of the P wave to beginning of the our Q wave. So this one is the P Q R S T. Okay, so from the beginning of the P wave to till the beginning of the Q wave, that is what we call as the PR interval, right? From the beginning of the Q wave till the end of the S wave, that is what we call as the QRS complex or the interval, right? Then from the beginning of the Q wave till the end of the T wave, that is what we call the QT interval. Okay, it's important. 2 to 3 times you people will get practice in your notebook. It will be helpful for you all. Okay, so then total how many intervals are there? 3 intervals are there, and 2 segments will be there. So what are the 2 segments? One is the PR segment, another one is the ST segment. So let me come to the count again. How many intervals are there? Total number of the intervals 3, total number of the segments 2. Okay, so total number of the waves 5, negative waves 2, positive waves 3, then isovolumetric lines 2. So this is the actual and correct count. So all people just take over one more time, repeat immediately after class. So it will help you all. Okay, so the next question is like this. Okay, so people can easily answer now. Okay, which part of the ECG wave represents the ventricular depolarization? Just now only we have discussed. That is the ventricular depolarization, which meaning ventricular relaxation, not relaxation, but so it's meaning the ventricular contraction, or we can say the ventricular systole. Okay, yes, which wave represents this one? Yes, almost all of you have given the correct answer. There is the QRS complex, which indicates the ventricular contraction or the ventricular depolarization or the ventricular systole. Very important. Then P wave we have studied already. That is the atrial contraction or the atrial systole. Okay, T wave only wave which represents the diastole or the repolarization. that is the ventricular relaxation or the ventricular repolarization, that is the T wave. Okay, very very importantly, we have discussed this one just now only. Okay, so let me come for the next question here. Yes, so this is important question, and this is a very basic question, all people have to know about this one. Okay, what is the standard speed of the ECG paper in most clinical settings? In the most of the clinical settings, what is the standard speed of the ECG paper? Yes, I want to answer in the comment box. Fatapat do comment for the answer. What is the standard speed of the ECG paper in the most of the clinical settings? Option A, 12.5 mm per second. Yes, almost all people have already chosen the answer, so I will not waste your time here. So that is the 25 mm per second is the standard speed. Okay, so where the ECG paper will run in the machine. Okay, so I have shown you the image. This is the ECG strips or the ECG paper. So what is the speed of this ECG paper which comes out or which runs in the machine? Which means 25 mm per 1 second. Okay, so bacho, by keeping this one as a base, we have to know the few more fact on this one that helpful for the exams. Okay, so in 1 second it is passing the 25 of the ECG strips, means in 1 minute, in 1 minute it should cross the 300 big box, or in 1 minute it should cross 1500 small box. Sir, what is this big box? What is this small box? Let me take you to here. Okay, bacho, look at the image. Just I am trying to teaching everything from the basic. So this one is the big box. Okay, so this red highlighted are the big box. In every big box there are 5 small boxes. Okay, consider this one is the big box. So in every big box there is 5 small box will be there. 1, 2, 3. This is 4 and 5. Okay, so then again 1, 2, 3, 4 and 5. 1, 2, 3, 4 and 5. Okay, so here this is what we call the red border one. We call this one as the big box. Sorry, this what we can say, the black border one are the big box. Okay, these are the big box, and the red border ones, so these are called as the small box. This big border one, which is 1 in, means, so this one big box is containing the 5 small box. It's important. So in one big box, how many small box are there? The question will comes, the 5 small box are there. Okay, so very very important, right? So if it is running 25 per second, means in 1 minute it should cross the 300 big box, and in 1 minute it should cross the 1500 small box. Bacho, I will repeat this concept again while calculating the heart rate by using the ECG. So there you people will understand why the Nagaraj sir have taught us the very basic thing that is necessary, because it is the basic thing where we will use again while calculating the heart rate. Okay, on the ECG strips, where the examiner will give you a image. Okay, and he will tell you to like calculate the heart rate by using this particular ECG strip. Okay, so there you people will get confused if you don't know the basics. So that is what I am teaching you people since from very basic. Okay, so standard speed of the ECG paper means that is the 25 per second, right? In 1 minute it should crosses the 300 big box, and in 1 minute it should crosses the 1500 small box. It is very very important. And the next question is, what is the amplitude of the one small box in ECG paper? Okay, just now I have taught you people, this is the big box. Let me take to the same image only, so it will be helpful. Okay, so this is the big box. So in one big box, I told five small box. The question is, for one small box, what is the amplitude? Amplitude means where in this ECG paper, we will check the height of the ECG on y-axis. Okay, this is the y-axis, and the duration of the ECG on the x-axis. Okay, right? This is the x-axis. This is the x-axis, and this one is the y-axis. So here on the x-axis, we will count the time duration. And on the y-axis, we have to check the amplitude or the height of the our waves which are generating like here. Okay, consider it is a p wave. So what is the height of the p wave? We have to say what is the amplitude of the p wave. Okay, so here one small box height is, we can say, the 1 mm or 0.1 millivolt. Very important. The one small box is having the 1 mm height or the 0.1 mm millivolt, means one big box is having 5 mm height or 0.5 millivolt. Okay, so don't get confused, bacho. Okay, so that is 5 mm we can say, or the 0.5 millivolt also we can say, it's the same. So if the examiner asking the height, give the answer as a 5 mm. If he is asking the amplitude, give the answer as a 0.5 millivolt. So he will never give both in the option, but very importantly, all you people have to know the height and amplitude is like this. Okay, on the y-axis. Okay, and the time duration of the ECG is measured in the x-axis. Okay, just now I have taught you people. So that is the just one small box is 1 mm. I have told already this one, and one small box amplitude is the 0.1 millivolt, and it is important. So this is what we have thought about the y-axis amplitude. So then comes to the x-axis. Okay, so this is the one large box we consider. In large box there are five small boxes, right? Five small box. So here each small box time duration where the ECG wants to pass is 0.04 seconds for one small box. Okay, so if the ECG running with a speed of the 25 mm per second, means what is the time it should take to cross the one small box, means that is the 0.04 second. Okay, ECG paper ಪ್ರತಿ ಒಂದು ಸೆಕೆಂಡ್ಗೆ 25 ಮಿಲಿಮೀಟರ್ ಅಷ್ಟು ಫಾಸ್ಟ್ ಆಗಿ ಸ್ಪೀಡ್ ಆಗಿ ಓಡ್ತಿದೆ ಅಂತಂದ್ರೆ ಒಂದು ಸ್ಮಾಲ್ ಬಾಕ್ಸ್ ಕ್ರಾಸ್ ಮಾಡಕ್ಕೆ ಇದು ಎಷ್ಟು ಟೈಮ್ ತಗೊಳುತ್ತೆ ಅಂತಂದ್ರೆ ಜಸ್ಟ್ ಇಟ್ ಟೇಕ್ಸ್ ಅ 0.04 ಸೆಕೆಂಡ್ ಟು ಕ್ರಾಸ್ ಒನ್ ಸ್ಮಾಲ್ ಬಾಕ್ಸ್. ಓಕೆ, ಸೊ just the same thing I have explained in Kannada also, nothing extra and nothing special, right? So that is very important. So for one small box it is taking 0.04 second. It means for crossing the one big box, how much time it will take? Yes, one small box is equal to one big box is equal to five small box, right? One big box is equal to five small box, right? So if it is taking a time of the 0.04 second for one small box, means it takes the 0.2 second, or we can say 0.20 second for the crossing the one big box. It's very important, bacho. So one big box will be crossed by the 0.20 second or 0.1 second. How, sir? How means? Just consider one small box is equal to, yes, 0.04 second, right? So in one big box there are five small box, so multiply it. So yes, that is the 5 4s are 20, so 0.20 seconds it will take to cross the one big box. It's very important. So the examiner asked the question, the amplitude will be taken on the y-axis and the time duration will be taken on the x-axis. The time duration which is taken to cross the one big box is the 0.20 second. The time duration which is taken to cross the one small box is the 0.04 second. It's very important. But so this is what all about a very basic thing on the ECG. In the tomorrow's class, we will study the abnormal ECG with image based questions. What is P pulmonale, what is P mitrale, okay, everything. So we'll just first we will consider the basic thing, then we'll go for the advanced thing. Then only people are able to interpret the ECG and what it is actually. Okay, that is very very important. So stay connected, stay uh, keep watching the all the questions and what are the discussion is going on here, because this is very very important, and which strikes the 4 to 5 questions miss the one question which will definitely comes from the very basic of the ECG also. Okay, in the tomorrow's class again we will discuss half part will be considered as a basics only, then after that we'll go for the very very important arrhythmias and all, so that you all people have to and must and should know for the our upcoming NORCET 8 exams and RRB exams. Okay, stay connected, stay motivated. If anyone is watching the master nursing classes first time means, so please do subscribe to the channel. Okay, so and there is one important announcement also there for you all. So we have the master nursing classes official app. So in that one, so we have launched the test series for the NORCET 8 exams. So the daily one live exam will be there. Total people will get the 94, so 95 exams. So among these, the 45 are for the prelims and 20 for the mains and extra 30 for your practice, where this extra 30 is having the very, very important questions. And these 45s are practical based, scenario based, image based, and the clinical setting based. And important thing that is comes for the prelims, and this means pattern will be very very important, that will decide your rank. Okay, completely planned and executed by the expert nursing officer. It is a very very and very affordable price. All the people have don't even think of the price also, so that is a very low price. So this is not for the earning money and all, just we are giving it to improve the our professional values, right? So that is the reason. And if anyone is watching the our YouTube channel first time, so please do subscribe. And if you still not have downloaded our Master Nursing class app means, so the description there in the link is there in the description box. Uh, and if people have also have any doubt means, you can join to our WhatsApp channel, and you can discuss there your doubts. So our admins and we are always there to discuss solve your doubts there also. So both the app link and the our WhatsApp channel link is given in the description box. So please do join there. So stay connected. We will discuss for the next session. So stay connected, stay motivated. We will meet again. तब तक के लिए जय हिंद, जय भारत.